Alpha-gal syndrome, the tick-borne meat allergy on the rise across the southeast. If you've ever broken out in hives or had stomach pain in the middle of the night after a steak dinner, you may be dealing with alpha-gal syndrome, AGS. It is a relatively new diagnosis, increasingly recognized across Florida, Alabama, Georgia, South Carolina, North Carolina, and Virginia, where the lone star tick is common. Unlike a typical food allergy, the reaction is delayed by hours after eating, which is why so many people live with it for years before getting a diagnosis. What alpha-gal syndrome actually is. Alpha-gal is short for galactose alpha-1, 3-galactose, a sugar molecule found in the meat of most mammals, beef, pork, lamb, venison, rabbit, and others, as well as in some mammal-derived products like gelatin, certain dairy items, and a number of medications. AGS is an immune response to that sugar. The trigger is almost always a bite from the lone star tick, Amblyomma americanum, the tick with a single white spot on the female's back. The tick's saliva sensitizes the immune system to alpha-gal. After that sensitization, eating mammalian meat or being exposed to alpha-gal in other forms can produce an allergic reaction. The CDC has identified more than 100,000 suspected cases in the United States since 2010, and the lone star tick's range now covers most of the Southeast. Symptoms. Why they're so easy to miss. The classic AGS reaction comes 3 to 8 hours after eating mammalian meat, which is the single biggest reason it gets missed. Most food allergies cause symptoms within minutes. Alpha-gal does not. Common symptoms include hives or itching, sometimes severe, stomach pain, cramping, nausea, vomiting, or diarrhea, swelling of the lips, throat, tongue, or eyelids, shortness of breath, wheezing, or a drop in blood pressure. In severe cases, anaphylaxis. Many patients first notice symptoms after a late dinner. They wake up at 2 a.m. covered in hives and have no idea why. If that pattern sounds familiar, alpha-gal syndrome belongs on the workup list. How AGS is diagnosed. Diagnosis is straightforward when the clinician is thinking of it. The primary test is a blood test for alpha-gal specific IgE antibodies. A positive result combined with a history of delayed reactions to mammalian meat strongly supports the diagnosis. Sometimes additional allergy testing is used to rule out other causes. Your provider may also ask about recent tick bites, time spent outdoors, and your reaction timeline. If you suspect AGS, schedule a visit with an internal medicine provider familiar with tick-borne illness. We routinely order alpha-gal testing for patients across the Southeast and interpret the results in the context of your full history. Visit the link in the description below for more information.